mind before you start. Inducers cause therapeutic failure of other drugs. Antiepileptics except VPA, carbamazepine, phenytoin, rifampin st, John's wort. Tobacco, smoking barbiturates. Zimetidine 1 2 Celsius substrate to culture bitter smoking, erythromycin, repeated cytochrome, azoles, verapamil amp, diltiazem cimetidine, verapamil, amiodarone, diltiazem, clarithromycin, grapefruit juice, erythromycin, 3A4 inhibitors, amiodarone, 2 Celsius 9 and 2 6 inhibitors smoking, tobacco, 1 2 inducer rifampicin, 3A4 and 2 Celsius 9 inducer codeine, 2 6 substrate rivaroxaban and apixaban, verapamil. Colchicine are metabolized by 3A4 digoxin, 3A4 phenytoin, irbesartan, and are metabolized by which CYP 2 Celsius 9. Clopidogrel prodrug, activated by 2 Celsius 19 ibuprofen, celecoxib NSAIDs, antihypertensives, losartan, phenytoin 2 Celsius 9 substrate lidocaine metabolism, 90% 1A2, 10% 3A4 bupropion, substrate to 2B6 and inhibitor to 2-6 measured 2 Celsius 9. NSAIDs, specially ibuprofen measure 3A4, erythromycin measure 2-6, dextromethorphan. 1. Theophylline smoking, theophylline level, very important. 2. Theophylline rifampicin theophylline level in March 2022, least to theophylline rifampicin 3. Theophylline ciprofloxacin 1 theophylline level 4. Take care theophylline ethylene diamine aminophylline drug that may increase aminophylline toxicity. Erythromycin. 5. Aspirin toxicity with which cytotoxic drug, MTX aspirin AMP, NSAIDs MTX toxicity paracetamol methotrexate, no RX6, cause hepatotoxicity. A. MTX leflunomide, B. MTX hydroxychloroquine C. MTX allopurinol 7. Cyclosporin erythromycin, diltiazem, verapamil, or 3A4 inhibitor, 1 cyclosporin 8. Sildenafil cannot use with nicorandil, very important. Warfarin, simvastatin, statin, thyroxine oral contraceptive, levonorgestrel warfarin, ciprofloxacin, AMP, moxifloxacin, amiodarone, all NSAIDs tramadol, itraconazole, voriconazole cotrimoxazole tibolone, azathioprine griseofulvin rifampicin St. John's wort carbamazepine, phenobarbital phenytoin, spironolactone atorvastatin ezetimibe coat, chloramphenicol, warfarin bleeding. Page 1 of 18 by Alaa Nasr Doc. Warfarin no interaction. Omeprazole, allopurinol, theophylline, morphine grapefruit coenzyme Q, CoQ10 9. Warfarin, which cause warfarin antagonism, Vit K10. Warfarin increased by all except amiodarone or statin or all NSAIDs or itraconazole or St. John wort. Inducer, 11. Statins warfarin, except atorvastatin, pravastatin 12. Least drug interact with warfarin, except atorvastatin or ciprofloxacin or ezetimibe 13. Drug enhance warfarin activity. A. Rifampicin B, phenobarbital C, cotrimoxazole D, carbamazepine 14. Drug antagonize warfarin is griseofulvin AMP, STIT, Hohn's wort 15. Warfarin is antagonized by a ginkgo B, omeprazole C, St. Warfarin interaction with a tramadol B, celecoxib C, spironolactone, which most interact with warfarin, aspirin, tramadol, AMP, NSAIDs bleeding of warfarin 17. Least interaction with warfarin. Allopurinol 18. Amiodarone, what is wrong? Not ink warfarin dose 19. Inhibit warfarin metabolism. Voriconazole. 20. Digoxin amiodarone. Reduced dose of digoxin to 1/2 21. Increased digoxin toxicity. Furosemide 22. Simvastatin cholestyramine interaction. December absorption of statin 23. Gemfibrozil atorvastatin 1 toxicity of atorvastatin. Risk of myopathy 24. Colchicine statin myopathy 25. Rivaroxaban ketoconazole 1 rivaroxaban not be used regarding rivaroxaban. Ketoconazole 26. CCBBB cause. Additive negative chronotropic bradycardia nifedipine atenolol. Additive bradycardia drug combination that must be taken with caution. A verapamil and beta. Blockers. This should be avoided. BNFB, any other CCB beta blocker, is a caution. X. Amlodipine metoprolol. In March 2022, verapamil metoprolol. 27. Clarithromycin verapamil 11 level or effect of verapamil by affecting CYP3A4. 2008. ACE spironolactone hyperkalemia. 2009. Grapefruit squanavir 11 squanavir level 150 220% 30. Metronidazole amp. Alcohol. Stop alcohol 24HR before starting metronidazole. Disulfura-like reaction drugs with ethanol, beta-lactams, cephalosporins, chloramphenicol, isoniazid, ketoconazole, grizofulvin, metronidazole, sulfonamides, chlorpropamide. Metronidazole interactions. Alcohol, warfarin, cimetidine, phenytoin and phenobarbital, disulfuram, 2 Celsius 9 amp, 3A4 inhibitor. 31. Perindopril celecoxib nephrotoxicity, ACN said 32. Increase gentamicin toxicity, suxamethonium 33. NSAIDs X, aspirin lithium Li excretion, 1 Li reabsorption, increase Li toxicity, diclofenac 34. Lithium amiodarone thyroid disturbance 35. Azathioprine allopurinol can't be used together at any dose, may be used by reducing dose of azathioprine. 36. Which cause oral contraceptive failure. Rifampicin oral contraceptive decrease metabolism of selegline and increase its toxicity. All drug interactions from recalls. Cont. Most common CAPS recalls till March 2022. March recalls are highlighted. All doses from recalls. 37. Esomeprazole absorption of itraconazole ranitidine or famotidine. Itraconazole, ranitidine decrease itraconazole activity, due to more absorption because of decrease. PHB, ranitidine decrease metabolism. C. Less absorption because ranitidine increases pH and itra needs acidic media 38. Omeprazole. Inhibit conversion of clopidogrel to active form AMP. Decrease effect of all azole family except fluconazole. 39. Diltiazem F. The effect of aripiprazole. Diltiazem aripiprazole, 1 level or effect of aripiprazole by affecting CYP3A440. Perhexaline, for angine, SSR perhexalin AMP, hepatotoxicity AMP, hypoglycemia. 41. Tetracycline CEI with milk or iron, doxycycline CPI with iron, and can be taken with milk tetracycline with calcium, antacid, chelation 42, ciprofloxacin with calcium, antacid, chelation. 43. Alendronate less abs with antacid Y. Complexation, alendronate C acomplexation. 44. Ascorbic acid used with methenamine to acidify urine increase formaldehyde, which has antibacterial activity. 45. Methenamine can be taken with all except A. Sodium citrate or tartarate, as they alkalinize urine which prevent methenamine hydrolysis to active drug formaldehyde. B. Ascorbic acid. C. Nitrofurantoin. 46. Why not alkalinizer with fluoroquinonols due to crystalluria? 47. L-dopa absorption decrease with protein diet. 48. Misoprostol. Asked in case study, piroxicam also prescribed decrease ulcers induced by piroxicam. 49. Sodium bicarbonate used for increase aspirin excretion. 50. Ezetimibe will not decrease absorption of other drug. Acarbose maximum dose 600 mg donepezil, 10 mg cimetidine, 200 to 800 mg misoprostol, 200 - 800 dapsone dose 50 100 mg. Digoxin 50 - 125 NCG once daily. Clotrimazole 500 mg single application. Paracetamol 15 mg AG every 4 - 6 hours. Hepatotoxicity if GT 150 mg H. Hydrocortisone in emergency 100 to 500 HOR every 6 HRS. Sildenafil 50 100 mg 1 HR before intercourse. Vit C 500 - 1000. In G day, lisinopril max 40 mg, birindopril max 10 mg, captopril max 150 mg, only Oshi taken more than once, taken 1 hour before meals. Aminoglycosides once daily. Doxepin max 300 mg, roxithromycin max 300 mg. Oral digoxin 125 - 250 fluoxetine 20 mg. Venlafaxine 75 mg daily. Diclofenac 200 mg day. Prednisone initially 5 - 60 mg once daily. Usual maintenance dose 2.5 - 15 mg once daily. Glycerol trinitrate sublingual tablet 300 - 600 micrograms. Recalls 0.51 mg. Aspirin rheumatoid arthritis 3 - 4 gm antiplatelet aggregation 75 150 mg daily. Hydralazine 5200 mg daily. Imipramine max 300 mg. Vancomycin 0.52 grams stay for 7 to 10 days. Or MRSA 125 - 250. Please note, maintenance doses GTT 100 mg daily are associated with an increased risk of lupus-like syndrome. Atropine 0.22 mg. The doses of clomiphene citrate, which is used in the treatment of infertility, should be taken on which of the following days off menstrual cycle? 5 - 9-10 mg Snapchat or instant message. Morphine 30 mg, morphine oral 100 mcg. Fentanyl Snapchat phenytoin maintenance dose 4-5 mg kg. Increased by 30 mg daily once every 2 weeks according to response. Usual range 200 and 500 mg daily, once or in 3 divided doses. Loading dose 15-20 mg phenytoin for status epilepticus 15-20 mg kg. Page 2 of 18 by Alaa Nasr Doc. Acamprosate, treatment of alcoholism. 666 mg 3 times doxycycline for malaria 100 mg 2 days before, during, and for 4 weeks after coming back from malaria. Place colchicines is 500 mcg orally with ibuprofen once or twice daily. If acute gout 1 mg initially, then 500 mcg every 6 HRs until pain relief or toxicity. X and D. Max dose 6 mg per course. Don't repeat the course within 3 days. Methotrexate once weekly. Rheumatoid arthritis 7.5 - 25 mg once each week for 6 weeks. Psoriasis 7.5 - 15 mg once a week, maximum 30 mg week. Herpes simplex encephalitis should be treated with acyclovir 10 mg kg Ivor every 8 HRS for 2 weeks, B acyclovir 5 mg kg pill every 8 HRSC, famciclovir dose of 1 gram cephalexin, TTT of UTI hepatitis a vaccine before travel by 2 weeks. Which treatment course with gentamicin is more likely to cause nephrotoxicity? 1 mg kg 3 times a day for 14 days if a patient has been ordered salbutamol aerosol and beclomethasone. Aerosol, both to be inhaled 4 times a day. The patient should inhale the beclomethasone 10 minutes after salbutamol. Northisterone is used to treat a variety of conditions. Which of the following doses is incorrect? Hormone replacement therapy. Orally 1.25 mg daily with continuous estrogen dose of progesterone and hormone replacement therapy. 1.25 mg day, 10-14 days. With estrogen, what is the range for the daily recommended allowance of calcium for women? 1,500 mg. A patient with a superficial wound asks what time period is recommended between tetanus immunizations. Every 10 years. Insulin Q1. When shifting from twice daily isophane to once daily glargine, the dose should be reduced by 20% to split mixed regimens. Combination of 30% short-acting and 70% long-acting. 2/3 of total dose before breakfast and 1/3 before dinner. 1. Tablets cannot be crushed. Alendronate, AMP, omeprazole 2. Which medication are to be crushed? Olperheptidine, apixaban can be crushed also. 3. Enantiomers, mirror image not superimposed. 4. Alendronate is similar in structure to pyrophosphate 5. Emulsifier for parenteral solution egg lecithin 6. Bond angle of atom in H2, 104.5, 105, or 109.7. What does not cause rhabdomyolysis? Ezetimibe 8. Cetrimide OW cationic 9. Oleic acid is anionic, and sodium lauryl sulfate 10. Not OO. Beeswax 11. What is cationic? Cetylpyridium, AMP, cetrimide, AMP, benzalkonium Cl12, HLB for ODO 2022, 5-18. Most common CAPS recalls till March 2022. March recalls are highlighted. 42. Leukocytosis, leukocytes 43. PT has high ALT, liver enzyme. Cause, casewoman use rifampicin, warfarin. Rifampicin. 13. Polysorbate used with cortisone Y. Solubilizer, wetting agent. 14. Formoterol, long-acting B2 agonist. LABA. 15. Vertigo TTT, berchlorperazine 16. Jacob disease causative organism. Prion 17. What is the nature of prion? Infectious proteins 18. Cholestatic hepatitis. Erythroestolate. Amoxicillin clave also 58. Structure of amino acid 19. IV loading dose of some drug, except morphine 20. Acidosis caused by which drug? A metformin. 21. 2q cystic fibrosis treatment. TT dronase alpha, both parents gene 22. Acacia insoluble in alcohol 23. First-line general seizures 2022. Tonic-clonic. Valproic acid, BPA 24. In absence seizures, ethoxamute 59. Hemorrhagic cystitis say of cyclophosphamide or aphosphamide hemorrhagic cystitis TTT, Mesna, water 60. Doxorubicin GT, cardiotoxicity 61. Bleomycin GT, pulmonary toxicity 62. Fats are wheat ester of glycerin, glycerol, and fatty acids 63. Eye drops weak, strong acid or base. Weak acid 64. Methylparaben ester of what? Parahydroxybenzoic aid methylparaben used as preservative 65. Clopidogrel is a prodrug. 25. Used safely in lactation. Final answer, carbamazepine 26. Mg sulfate and citrate. What kind of laxative? Osmotic 27. Magnesium stearate uses. Lubricant 66. No need tapering or withdrawals. Fluoxetine 28. Causative agent for meningitis age 2 to 10 years. Neisseria. Meningitis less than 2H. Influenza 67. Most appropriate for bilateral artery stenosis in PT taking verapamil, ramipril, candesartan, metoprolol, methadone 68. PT with asthma and HTN shift aspirin 2, walpodogrel 29. Long-term use of prednisone causes on face what? Telangiectasis 69. What is true for cystic fibrosis? Drugs are metabolized quicker. Metabolism 30. Ferrous gluconate 11.7 and ferrous fumarate 33% and ferrous sulfate 20% 70. Not for tachyarrhythmia. Atropine 31. Drug safe in IV bolus. Salbutamol not for ventricular tachyarrhythmia. Verapamil, diltiazem, digoxin 71. LiceQuest. Eggs about 6 megameters from shaft. 32. Ethylene oxide disinfection method. Ethylation 33. Contamination of drug occur through, except, occlusion, absorption, inclusion, exclusion. 72. And another one WN's insecticide kill lice and eggs 73. Used for vertigo. Ucoporperazine. 34. In lab pharmacies, should not touch or cut neoplastic tablets 74. Not used in pregnancy. Rochlorperazine, AMP, diclofenac. 35. Which not used in open-angle glaucoma. Tropicamide 75. Aspirin toxicity cause. Respiratory alkalosis, AMP, metabolic acidosis. 76. Which laxative make dependence. Biscotal, AMP, Senna. 36. Which not used in closed-angle glaucoma. Latanoprost 37. Q fever. Coxilla burnetii, AMP, TT doxycycline. 38. Not seen in lab in iron anemia. High transferrin 77. Surfactant, definition of hydrof and lipophil in same molec 78. Safe in pregnancy. Acyclovir 79. Acetazolamide causes. Renal stone. 39. Not used as antianginal agent. Verapamil, perindopril, acimetoprolol. 45. Cause meiosis, constriction in eye pupil. Pilocarpine 46. Pilocarpine is cholinergic agonist 47. Whooping cough TTT. Macrolide AB. Incubation period 1 to 2 W 48. IV infusion for hypertensive crisis. Hydralazine 49. Aspirin toxi in child not use. Disodium editate 50. TCA not say. Insomnia. Salivation. Diarrhea. Many questions 51. Cystic fibrosis is change in protein which alter what? 1Cl and Na transport 52. Least effect on coxone. Paracetamol 53. Osmotic diuretic. Mannitol 54. Clozapine causes hyperglycemia AMP, granulocytosis GT-DT. Needs weekly monitoring 55. Cisplatin what is appropriate. Contains platinum, AMP, 2 adjacent Cl56. Fluoride toxicity. TCl257. Definition of molarity. Number of moles in 1 liter solution. 40. Not appear in asthma. 5-HT41. Pneumonia TTT. Amoxicillin. If allergic to penicillins, choose doxycycline or clarithromycin. 80. Not cause hyperglycemia. Mefloquine 81. Case study asking about what is main risk factor of polynephritis. Diabetes, HTN, COPD. Page 3 of 18 by Alaa Nasr Y. 82. Immediate release tab limiting rate. Dissolution 83. Pregnancy safe. Amiodarone, carbamazepine, acitreosin 84. Not an HF. Amlodipine, CCBS 85. Ketone or aldehyde group in methadone, prednisolone, camphor, caffeine 86. Longest-acting opioid. Fentanyl patch, if not present GT, methadone 80. COPD, should not use fulcodine 89. Cholinergic crisis with treatment of which disease? Parkinson, myasthenia gravis, pheochromocytoma, paralysis ileus 90. Cretinism, which ion decrease iodine 91. Traveler diarrhea, which antibiotics for treatment? Exfloxacin, norfloxacin 92. Antioxidant, tocopherol, vit E 93. Not chelating agent GT, Mg metabosulfite 94. Starch, disintegrant 95. Methotrexate toxicity give. Leucovorin, folinate, folinic acid 96. For prevention of methotrexate toxicity, folic acid 97. Erythromycin, lactone ring 98. Celecoxib, pyrazole ring 99. PTHD, 1 bone resorption and catua excretion 100. Selegiling, MAO-B inhibitor 101. Whooping cough TTT, macrolides 102. Polysorbate cortisone GT, solubilizer, wetting agent 103. Polysorbate coultar GT, dispersant 104. OTC for lice, pyrethrin, permethrin 105. Safest analgesic for GIT, ibuprofen 106. Causative M. O. Impetigo. S. Aureus amp. Strept. Piogen 107. Morphine metabolite. Morphine 6-glucurnoid, M6 grams, 108. Penicillinase resistant AB. Oxacillin, cloxa, dicloxa, flucloxanepsilin, methicillin 109. Stock's law, factors affecting it. Density, viscosity, specific gravity, particle size 110. Metformin, big one-eyed 111. Wrong about adrenaline autoinjector, given Snapchat full dose 112. Doc for trigeminal neuralgia, carbamazepine 113. Emgo act via. Chemical mechanism 114. Case asthmatic PT, AMP, CFF AMP, angina. Aspirin shift to clopidogrel analgesic after dental extraction. Paracetamol, not common say of aspirin. Urticaria, docusate sodium. Chronic flatulence. Stop 24-HR before diuretics due to hypotension. IC 115. UV range 200-400-116. Loading dose depends on CPO amp, VD 117. Procaine degradation, hydrolysis, amp, penicillin, 118. Biphosphonates, alendronate, don't cause hyperglycemia or hypoglycemia, 119. HTN angina tachyarrhythmia, TTT verapamil, 120. Preparation of key, GT, H20, GT, iodine, GT, peppermint amp, glycerine 121. Dipyridamole, antiplatelet 122. Atenolol and angine. Heart rate, oxygen demand 123. Why GTN, not orally? Due to first pass effect, 2022 high absorbed from buccal cavity, 124. Shingles appear after 72 HR 125. Cheatuo, dichloromethane. Monotropic, homotropic. Most common CAPS recalls till March 2022. March recalls are highlighted. 154. Not used in angina. Perindopril, C155. Ethylene oxide sterilization. Alkylation 156. Neurotransmitter released from synapse. Acetylcholine 157. Milk production. Prolactin. 126. PT with RAM. Allergy to tramadol. Taking celecoxib but still having mild pain. Fish oil or PCN codeine or oxycodone if said all can be used except. Choose fish oil 127. Drug causing sunburn. Doxycycline 128. Fasting drug absorption for on empty stomach. Flucloxacillin. TAMP. Ampicillin 2022 129. Least likely to occur with thiamine bone due to chronic alcoholism. Neuritis amp. Muscle pain or hardness of skin or increase. Pyruvate 130, which NSAID cause least get upset. Naproxen or piroxicam or meloxicam 131, which is not say of chlorpromazine. Hypertension 132, not affect the mortality in HFTTT. Digoxin 133. Aminoglycosides say nephrotoxicity amp. Ototoxicity 134. GTN in amber bottle, light-resistant bottle 135, which is not measured by immunoassay. Electrolyte 136, which forms salt with sodium bicarbonate or potassium carbonate in 2022. Ibuprofen 137. Dephenoxylate is given for acute uncomplicated diarrhea 138, which is compatible with anionic surfactant. Ichthamyl 139. Dronabinol is isomer of tetrahydrocannabinol, HC 140. Incorrect. Antifactor XA is used for measuring apixaban 141. Analgesic for dental. Paracetamol 142. Captopril will cause decrease in aldosterone 143. Amphetamine related to phenylethylamine 144. Ibuprofen metabolism. Ester hydroxylation then glucuronidation. ASW and 2.145. Drug metabolized by phase IAM. A second. Diazepam 146. Factors for vitamin K. 27,910, 147. Not used in the third trimester of pregnancy. Diclofenac. 158. Man 65 years old vaccine every year. Influenza 159. Most channel in epilepsy. Night channel 160. Plasma expander. Dextrin 161. Psoriatic lesions. Keratinocytes 162. Insecticides. Kill eggs amp. Nits 163. T3 amp. A4. Orally absorbed 164. Shortest acting benzodiazepam. Midazolam 165. Most NAMP. V chemotherapy. Cisplatin 166. Not true about TNF. Antiviral 167. Two drugs don't need dose adjustment when shifting from one to the other one. Diclofenac NA and K168. Hemodialysis. Polar compounds 167. Not action of nortriptyline. Constrict pupil 168. Wrong about paraffin. Made of unsaturated hydrocarbons 169. Dexamethasone in chemotherapy. Against NAMP were 170. Ni precursor. Tyrosine 171. Serotonin precursor. Tryptophan 172. Clopidogrel B2E12 173. Bacteroid fragilis. Cefoxitin 174. Hyperglycemia, hyperuricemia, hypomagnesemia, HTTZ, hydrochlorothiazide 175. True about enantiomers, not superimposed 176. Vitamin not related to eye, Vit D 177. Wrong for suppositories. Melt below 300 178. Responsible for spermatogenesis 179. Irbesartan. Once daily, candesartan in 2022 180. BPH. Finasteride 181. Hydroxylated steroid metabolized by glucuronidation steroid phase IAMP, lantha metabolism. Hydroxylation then glucuronidation 182. Role of A or CA in CA editate. Stability 183. Hypermelosin morphine, coded 184. PT take digoxin A. Suddenly NAMP BV occur. He took verapamil and toxicity. Occur. 185. PT has UTI, taking ciprofloxacin AMP. No improvement. What's the cause? Antacid 186. Anaphylactic reaction. Occur within minutes. Anaphylactic reaction. After second exposure 187. Penicillin metabolism. Hydrolysis 188. Dry powder sterilized by 1,600 for 2HR 148. Antifungal used topical and parenteral. Amphotericin 149. Amphotericin B used for aspergillus 150. Dabigatran metabolized by conjugation, only phased by the 189. Vancomycin C. Ototoxicity liver 151. Sporocidal, glutaraldehyde 152. Ethylene, diamine, theophylline, aminophylline 153. Nitrates, oral, sublingual AMP, topical 190. Wrong about morphine, metabolite excreted hepatically 191. Not have active metabolite. Nifedipine 192. Pilocarpine, constrict pupil 193. Not aromatase inhibitor. Nalutamide. Page 4 of 18 by Alaa Nasr 194. Most in blood. Erythrocyte 195. Velocity is faster in arteries 196. Lipophilicity. Propranolol GT. Metoprolol GT. Larilol 197. Used for trichomoniasis. Tinidazole 198. Not a biological DMARDs is auranofin 199. Chondrocyte in osteoarthritis tophi and gout. Panis in RA 200. Least to produce ATP. Pentose phosphate pathway 201. Theophylline is used with no precaution in renal impairment 202. Diphenoxylate least to cause bronchospasm 203. Not given in aspirin toxicity. Etiate 204. Used in acne. Benzoyl peroxide 10% or 5% in my module. 2022 205. Mice. Gravis. Autoimmune disease. GT, cholinergic. Receptors 206. Not in Parkinson. Dyskinesia or hyperreflexia, if present, 207. When holding chemotherapeutic drug, which is wrong. Crushing of tablet should only be done by pharmacist 208. Drug undergo acetylation. Isoniazide, also dapsone. Sulfamide, hydralazine, procainamide, 209. BDZ-MOA, stimulate GABA, 210. Pyrantelpamate is used as anthelmintic, threadworm, 211. Doc for herpes virus, acyclovir, 212. Doc for nocturnal enuresis, imipramine, 213. Drugs specially used for urgency, oxybutynin, 214. Not used in depression, haloperidol, 215. Common adverse effect of antineoplastic drugs, bone marrow depression, 216. If PT, take low NA intake, change to potassium chloride, 217. Legionella TTT, amoxicillin, 218. MGU, O2 as laxative, physical, osmotic laxative, and work as chemical as antacid, 219. Zidovudine drug class, NRTI, 220. TTT, neurological pain, amitriptyline, duloxetine, gabapentin, 221. TTT of trigeminal neuralgia, carbamazepine, 222. MOA antipsychotics in heat stroke, anticholinergic, 223. Propranolol not used in hypothyroidism, used in hyperthyroidism, 224. Antihypertensive not given in history of depression, methodopa, clonidine, 225. Anaphylactic shock, TTT, adrenaline, 226. Emulsion stability depend on deference bet, density, 227. Drug treat, proteinuria, ASI, AMP, ARBs, 228. Warfarin monitored by INR, heparin monitored by PT-AMP, APT, 229. Not factor in determining therapeutic approach in breast cancer, TTT. Age of PT, 230. Not induce seizures. Loud noise, AMP. Moderate exercise, 231. Diabetic ketoacidosis. Ketone body production, 232. CSF, not TUR, used as antiviral, 233. Phenobarbital toxicity. Give 0.2 supplement, 234. Should be absorbed in the intestine to provide action. Acarbose or methionine or sulfasalazine or vancomycin, 235. TTT of alcohol toxicity. Fompizole, 236. Cause pseudomembranous colitis. Phenoxymethylpenicillin, penicillin V, and clindamycin. TTT of P. colitis. Metronidazole, oral vancomycin. Most common CAPS recalls till March 2022. March recalls are highlighted. 269.2Q. Dronabinol, which is true. Isomer of THC tetrahydrocannabinol. Another name is delta-9-TC, 270. Dapagliflozin not cause. Cough, 271. Not used in CMV, cytomegalovirus. Famciclovir, 272. Not used in genital herpes. Ganciclovir, 273. Which one not through Cox? Tramadol, 237. Which organism caused pyelonephritis? E. Toli, 238. PT, take IV infusion. Dose CSS affected by T-half, 239. Vitamin that has similar structure to steroid. Vit-D, 240. Diphenoxylate similar to which drug? Pethidine, meperidine, 241. Atropine and diphenoxylate least likely to cause. Bronchospasm, 242. Term used for bluish discoloration of nails and toes. Cyanosis, 243. Tolnaftate is antifungal, 244. WT gain happen with glipizide, 245. Common cause of sore throat. Viral, 246. not given in COPD. Mast cell stabilizer 247. PT's hypertensive amp has non-productive cough, taking fulcodine. Stop what? Ramipril 248. NSAID, safe in Git. Celecoxib, if not present, choose ibuprofen 249. Oily cream, incorrect. Aqueous, hydrophilic, base 250. Chlorpromazine, what is not say? Hypertension 251. Salbutamol given to fee bolus 252. Procaine degradation by hydrolysis procainamide GT, etylation, also isoniazide, sulfonamide, dapsonide 253. Protein structure, select best. Sequence of amino acid structure 254. Penicillin act by inhibiting peptidocan 255. Boiling protein with ethylene dioxide, alkylation 256. FH secreted from anterior pituitary 257. Prednisolone least cause, drowsiness 258. Etanercept, biological DMARD 259. Metered dose inhaler, choose incorrect, don't shake before use 260. SEEP enzyme, metabolism site. R, endoplasmic reticulum, ribosomes 261. Atropine toxicity, dilate pupil 262. Which drug don't belong to same class as streptomycin? Vancomycin in CPR, viomycin 263. Wrong about alkaloids. pKa less than 7, 264. Epileptic in pregnancy. Lamotrigine 265. Fetus lung maturation, dexamethasone, if not present, choose betamethasone 266. Drug don't go, adulation. Gentamicin 267. Generalized or tonic-clonic seizure. Valproic acid 268. Absent seizure. Ethosuximide 268. Pregabalin GP MOA, GABA analog 274. Vomiting not triggered by emotions or CTE, baroreceptors part in inner ear 275. BPH, terazosin and finasteride 276. Vaginal candidiasis. Ketoconazole, keep trichomoniasis, tinidazole in mind 277. Chromatography, separation of materials ACC to charge ions 278. All suitable for relieving mild pain and arthritis except fish oil 279. Cold sore TTTT, topical prep, is more effective than oral 280. Case on methotrexate amp, leflunomide. Methotrexate amp, leflunomide liver failure, not working, switch to adalimumab 281. Postpartum breastfeeding not suitable, paracetamol codeine 282. Biotransformation reaction can occur in kidney or in liver only or same, in all organs 283. Enoxaparin, renal dose adjustment 284. Isoniazide cause, pyridoxine B6 deficiency 285. Case on digoxin, HF, perindopril N-ampam, digoxin, avoid insulfa allergy, celecoxib 286. Mycoplasma, no cell wall, 2022, not destroyed by penicillin, 287. Taken without food, flucloxacillin 288. Acid-resistant amp, penicillinase-resistant, flucloxacillin 289. Not studied in pregnancy, ciprofloxacin 290. Least true for VIT-D, increased CA excretion 291. Organophosphare MOA, inhibit Acetylcholinesterase, irreversible, 292. Anti-epileptic, block N channel, 297. Not used in glaucoma, homotropine, 298. Retinopathy, hydroxychloroquine, 299. Asthma not exacerbated by St. John's wort amp, hot air 300. Meclobamide, MAOA inhibitor racioline amp, Seligline, MAO-B inhibitor 301. Creatinine excretion level, 10% through tubular 302. Not dissolve in aqueous solution, phenytoin 303. Doesn't affect mortality in HF. Digoxin 304. Digoxin not known in 2022. Used in HF and atrial fibrillation 305. Which CAT2 not taken orally. KCL2 306. Purentel is used in threadworm infections 307. Celecoxib doesn't affect thromboxane 308. MOA of furosemide inhibit NAO K2Cl cotransporter system 309. Natural drug used in Paget's disease, calcitonin 310. 1-Theophony-5-dihydroxybit D3 or 1-25-dihydroxycalciferol, calcitriol, page 5 of 18 by Alaa Nasr Y 311. Local anesthetics MOA, NAE channel 312. PT with diabetes advice. Not to remove corns and callus 313. Not used in chemotherapy-induced NAM, brochlorperazine 314. Ceoleate, emulsifying agent 315. Protein waste product, urea 316. Dental surgery, paracetamol 317. TTT in anaphylaxis, adrenaline 318. Total capacity, vol or vital capacity, 319. Shelf life for eye drop, 28 days after open 320. Psoriasis, T-cell mediated autoimmune disease, 321. Active metabolite of sulfasalazine, 5-ASA 322. Active metabolite of azathioprine mercaptopurin 323. Erythropoietin. A hormone stimulates bone marrow to produce new RBCs 324. Which of the following mask bitter taste? A. Enteric B. Film C. Enteric and sugar D. Film and sugar 325. Use of topical urea. A. Humectant B. Anti-inflammatory C. An occlusive film D. Demulcent. 293. Corticosteroids regulated by ACA 294. Sulfonamide MO. Folic acid synthesis 295. Stokes' law, directly proportional to difference in density, viscosity, cephaloporazone, ceftriaxone, oxacillin, naphthalene. 296. Weakest acid, boric acid 331. NH4Cl, tationic, not used with naloryl sulfate 332. Not induce asthma St. John's wort amp, hot air, potent asthma. Inducer according to options is celecoxib 333. Whooping cough, pertussis, what is not? Viral infection 334. Isoniazide given with it B6 335. Which one is phase 2 metabolism? Sulfate conjugation 336. Which part of ear for equilibrium? Inner ear 337. HTN diabetes, ACE inhibitors 326. Lamivudine mechanism is as a nucleoside reverse transcriptase inhibitor in treatment of HIV 327. Used in retinitis related to HIV, cidofovir 328. Safe in pregnancy, zanamivir. Look at 271 amp. 272, 329. Enoxaparin needs dose AJ in renal failure. AMP, ceftazidime, aciclovir, ciprofloxacin, allopurinol, cephalosporin, digoxin, methyldopa, amikacin, vancomycin. Baclofen, no need for dose adjustment of phenytoin. AMP, diltiazem AMP. Theophylline in renal failure 330. Dose in hepatic failure. Theophylline, amiodarone 338. HTN angina, verapamil, anti-afetapine 339. HTN angina arrhythmia, verapamil 340. HTN angina me, atenololosartan, is the only ARBs that has uricosuric effect 341. Which one have sulfonamide allergy? Celecoxib,